All right, well, thank you for having me this, I guess now afternoon. As Diane mentioned, my name is Jennifer Lasley, and I'm the Director of Information and Community Services at the Central Plains Area Agency on Aging. We also operate as the Sedgwick County Department of Aging and Disability Services. My contact information is up there, and it'll also be available later at the end. All right, so as Diane mentioned, we have lots of services that we offer at our organization, and so I'll today be talking about who we are, what we are, when we were established, where, why we serve, and why we're here. So the who, what, when, where's, and whys. All right, so as I mentioned earlier, we operate as the Sedgwick County Department of Aging and Disabilities. That's actually who our employer is. So we're all Sedgwick County employees. And within that organization, we have lots of different sub-agencies. Those sub-agencies operate under different funding sources, so we have different working agency titles that we operate under. So if you call our office or speak with one of our staff members, they may address us as a different agency with a different agency name, but we're all in the same department, just working under different sources. So we have the Central Plains Area Agency on Aging, also known as CPAAA, which covers Sedgwick County, Butler County, and Harvey County, older adult services as well as family caregiver services. And then we have the Sedgwick County Department on Aging, which just covers aging services within the Sedgwick County limits. We also have Sedgwick County Transportation, which provides transportation to rural Sedgwick County residents who are needing transportation into the city of Wichita. And then also here recently, within the past couple years, we merged with the Sedgwick County Community Developmental Disability Organization, also known as the SCDDO, which provides intellectual and developmental disability services. All right, but today I'm mostly focusing on services provided through the aging side of our department. So with Central Plains Area Agency on Aging, the majority of the services that we provide are going to be for adults 60 and older, as well as caregivers to individuals who are 60 and older. And then we also have some services that cater to individuals living with disabilities. Some of the services that we include, wide array. We'll go into detail about that here shortly, so I'll kind of skip over that for now. A little bit of background information on how the AAA got started. So the Older Americans Act was passed in 1965 by President Lyndon Johnson, and it was a part of his Great Society initiative. The goal of the Older Americans Act was to assist people living at home to help increase their dignity and independence for as long as possible. After that initiative, the area agencies on aging were created all across the country. So there are AAAs all across the country to service every county in the country. And here in Kansas, there are 11 AAAs, and actually, let me go to my next slide here so you can see. We have 11 AAAs in the state of Kansas, and the service area for Central Plains is in the pink there, and PSA 2 covering Sedgwick County, Butler County, and Harvey County. As you can see, we're small geographically, but we're actually one of the largest AAAs in the state because of our metro city area, but we also have the largest populated county in the state as well. All right. So why are there AAAs? The AAAs are a grassroots organization built to provide connectivity, advocacy, and information to individuals in their respective communities. And our mission at CPAAA is to assist older adults, caregivers, and individuals with disabilities to achieve improved health and greater independence. So next, I'm going to transition over into actually just talking about this services and programs that we offer internally through our agency. The first one being the Client Assessment Referral Evaluation, which also known as a CARE assessment. So this assessment is mandated by the federal and state governments that that the AAAs are responsible for completing an assessment to determine eligibility for anyone who's considering long-term care nursing placement. So for anyone who's been in a rehab facility or a long-term care facility, once they've reached that 20th day stay and it's looking like they're going to need to stay past 30 days, then they are required to have a functional assessment to determine their continued eligibility to stay at the facility. So those facilities will contact our office to schedule that assessment, and we have assessors that go out into the community to complete those assessments and determine eligibility for those individuals that are considering to stay in the facility past 30 days. Oh, and I forgot to mention, if anyone happens to have any questions, feel free to stop me at any time. I'm happy to ask questions as I go, or there'll also be an opportunity at the end if you have any questions. Another program that we offer is the Older Americans Act 90-Day First Steps program. For a lot of individuals that contact our office, this is going to be like their first initial contact with our services, or maybe it's their first episode of a health crisis or the start of some health conditions that they're dealing with and maybe needing to access services for the first time. So with this program, it's available to individuals that are 60 and older and living in Sedgwick County, Butler County, or Harvey County. And what we offer is up to 90 days of in-home service for individuals who are transitioning out of a facility and moving back home. After you've had your hospital stay, or maybe you were at a rehab or a nursing facility, you might need some additional assistance as you're transitioning home. And so we have staff available to support with that transition. You'll get assigned a case manager that will assist you with any resources that you're in need of for those 90 days. And we can provide in-home services, which would include your personal care, such as attendant care, like if you're needing help with bathing, dressing, toileting, but then also providing homemaker services if you're needing help with your laundry, your housekeeping, your grocery shopping and things like that. We can get you connected with one of our contracted agencies that can come into the home and provide that service to you on a regular basis. For some individuals, as they reach the end of that 90 days, they identify that they're going to need some continued support after the 90 days. And so if so, we could have that case manager assist with finding other programs that they may be suitable for and help with the transition over to a more longer-term program for them. One thing I also wanted to mention about this program is that it is free of charge for the participants. This program is fully federally funded. So although there's no charge to the individual, we do accept donations for just about all of our programs, and that just helps us stretch those dollars and be able to support as many people as we can. Another program that we offer for in-home services is called our Senior Care Act program. And this is very similar to the previous program that I mentioned, providing those in-home services and the case management. But this is going to be a more longer-term program for folks that are needing services on a continual basis. So again, we're serving adults 60 and older. This program, unlike the other program I mentioned, this program operates on a sliding fee scale based on the individual's income. So based on their income, they may potentially be responsible for paying a copay out of pocket, and anything in addition to that copay would be covered through our funding. This program, again, is providing those case management services, the in-home services, your attendant care, your homemaker services. But this program is more expanded to where it can also offer a personal emergency response system, which is like your call button. If you have an individual that's a frequent fall risk, then we can provide that call button system with the monthly monitoring. This program also offers self-directed care options. So it offers agency-directed care, which is if you would like for one of our contracted agencies to be your in-home provider. But if you have a friend or a family member that's already providing care to you and you're wanting them to get paid for that care, then we could go the self-directed care option where we could get you set up on payroll, get that caregiver set up on payroll through an agency, and they get paid for the services they're providing to that individual that's 60 or older. Currently, this program does have a wait list. I would say, a relatively shorter wait list. At this time, I would say maybe waiting potentially up to a month for services, which is reasonably lower than some of the other wait lists for other programs that you may be familiar with. But once you're on this program, you can continue to stay on it for as long as you're meeting that functional eligibility for the service. A third in-home service program that's offered through CPAAA is the Family Caregiver Support Program. This program, again, is similar to those other two in-home programs that I mentioned, but with this one, the idea is that we're assisting that family member that's providing assistance to their loved one by giving them a break from their caregiver duties and letting our staff come in and provide that service for them. So with this program, the person that's 60 or older would need to identify a family member that they consider their caregiver that's helping them on a regular basis. And that caregiver is who we would identify as our client that we're assisting. And we're assisting them by us going in and helping with the laundry, the bathing, the housekeeping, the toileting, the shopping, things like that, and giving that caregiver a break for them to go do other things. This program, in addition to the attendant care and homemaker, offers the respite care, which is just, giving that caregiver a break. There is a caregiver coordinator, which would be the point of contact through CPAAA in case that caregiver has any other needs or looking for resources or needing to get connected with other programs. And they have a point of contact that they can reach out to for that support. We also provide support to caregivers through individual counseling. We have a licensed clinical social worker who can provide up to 12 counseling sessions annually. That is free of charge and available to caregivers while they're caring for their loved one, but then also even up to a year after their loved one has passed on. So that's a pretty neat perk. In addition to the individual counseling, we also offer a family caregiver support group that meets once a month. And that support group is available both in person and remotely for those that prefer that. We have a private Facebook group, which is also a caregiver support group online for those that are wanting just, some encouraging words or wanting to just connect with other family caregivers. And then we also, I need to update this. We have transportation listed on there. We actually just recently discontinued our transportation for caregivers. But if someone does have a need for transportation, they can still contact our office and we can get them connected with those resources. Let's see here. Another service offered to caregivers is the Kansas Respite for Alzheimer's and Dementia, also known as the KRAD program. This is a newer caregiver program that's available across Kansas, and it is to support family members who are caring for a loved one that has a diagnosis of Alzheimer's or other related dementia. So with this program, it offers up to $1,000 expense for us to provide respite care to that caregiver. So we have contracted agencies that we would reimburse up to $1,000 to give that caregiver a break for them to do other things of their choice. All right, so some other community-based services that we offer internally includes our transition program. The transition program is going to be for individuals who have been living in a facility and now they're moving back into the community or moving home. And so with this program, we can offer both case management assistance as well as financial assistance to help with that transition, to see that they have a safe transition back home and be able to maintain independently at home. And that can look different for many different people. So maybe someone is moving into an apartment and they're needing help with, the down payment on the apartment, or maybe in order for them to move back home, now they're needing a wheelchair ramp built on their home, or they're needing a lift chair in their home or a hospital bed. We have financial resources available that can provide those items so that that person can maintain safely at home. In addition to the transitions program, we also have short-term case management, and this is going to be available for individuals who are just needing some hands-on assistance with your odd-end tasks on a short-term basis. So an example of that would be maybe someone's needing help applying for Social Security benefits. That can be a very tedious task, and maybe one that they might benefit from having someone help walk them through that process. We can assign them a case manager that can help them apply for Social Security benefits. Or maybe they're needing help applying for Medicaid or looking for housing options. Just something that's going to be short-term that they could benefit from having some guidance and assistance. We also have administrative case managers available who can assist individuals that are seeking services through the Home and Community-Based Services waiver that's available through Medicaid. Also referred to as HCBS waiver. So there are several different waivers available to Medicaid beneficiaries to assist them in the homes. Those things I mentioned earlier, your house, your bathing, your dressing, your toileting, shopping, to be paid for through Medicaid funds instead of those federal funds or those private pay funds. But in order to be eligible for HCBS, there's lots of paperwork that must be done. You have to fill out the Medicaid application. You might have to obtain medical records to identify your disability diagnosis, or maybe you're needing to provide documentation that you're on Social Security disability. So for some people, that might be challenging for them to navigate and collect all of those documents, and so we could assist you with our case managers. And then we also provide eligibility assessments for individuals who are seeking home-delivered meals, so your Meals on Wheels programs. We provide funding for the Meals on Wheels programs in Sedgwick County, Butler County, and Harvey County, but in order to get on those programs, you have to be determined eligible through an assessment. So we have, for folks wanting those services, they would contact our office, and we would get them set up with that assessment to get those programs started for them. Another program offered is the Minor Home Repair Program. This is available to, again, individuals 60 and older in Sedgwick County, Butler County, or Harvey County. And this is to assist with any minor needs that they have in the home to help them maintain safely at home independently. So some of the things that we commonly assist with is building wheelchair ramps for folks that are in need of that. Or maybe they're needing some grab bars in their restroom, on the toilet or in the shower tub area. Maybe you're needing a toilet seat riser, lift chairs, things like that. Maybe you're needing your carpet pulled up so that you can navigate through your home and your wheelchair safely. So just different things that we can assist with that. One of the things about this program is the individual must be current on their property taxes, and they must be the homeowner of the home. Occasionally, this program may require a copay out of pocket depending on the person's income, so that's also something to be aware of for this service. In addition to the caregiver counseling services that I mentioned earlier, we also have counseling for adults 60 and older, and that's also provided by our licensed clinical social worker, providing up to 10 sessions annually. I think we just increased that to 12 sessions now. So 12 sessions annually for mental health services. And then I mentioned the caregiver support program earlier, but then we also have a clutter cleaners club, which is our hoarding support group. I see a lot of people nodding their heads. You might be familiar with that one. So that's a really popular support group that we have as well that's available once a month. Another program is our diabetes education and wellness services. We have currently this position is vacant, so if you call us, it might be a little bit of a wait. But we provide education to anyone who has been determined as pre-type 2 diabetic. So this isn't necessarily for individuals who've already been determined diabetic, but anyone who's pre-diabetic could go through a course to learn about ways to improve their nutrition, to slow that process of becoming type 2 diabetic. It is an evidence-based program. Some other programs that we offer would include a Tai Chi Quan class and enhanced fitness classes to adults 60 and older. We provide those classes out in the community at several different locations, your senior centers, your community centers, different places in the 3 counties. We also have a Matter of Balance program, which is a fall prevention course that you can take to help educate on ways to avoid falls, but then also how to fall safely. It goes over various things such as how to reduce trip hazards in your home and things like that. We also have a YouTube channel where you can check out Joe on the Go is the name, with our exercise coach, Joe, and some ways that you can work on enhanced fitness at home. Let's see. Information and assistance. This is, if you call our office and you're looking for resources or information about programs that are available to individuals 60 or older, resources to help caregivers, you can just call our office at the 316-660-5128 number, and that'll get you connected with one of our trained specialists that can get you connected with what you're needing. So all of these programs that I'm mentioning and discussing, you can just call that general phone number and let them know what your needs are, and they'll get you connected with the program that would best suit your needs. Or maybe you don't know what you're eligible for, or what services are available, or who to contact, or maybe there's some external programs outside of our agency that you're just wanting information with or wanting to get connected with. We try to act as like a one-stop shop to get you to those resources that you need, so that you're not having to call around and ask around and find those resources through all the many different things that are available. Let's see here. And we do try to provide non-biased information. So if you call us, we're not going to steer you in a certain direction. We're just going to let you know what options are available to allow you to make those decisions for yourself and really get the program that you think would best suit your needs. Outreach, we provide lots of outreach to the community, providing educational presentations on things such as scams, wellness services and programs, or just wellness, self-care wellness. We have educations on Medicare, Medicare Advantage, caregiver resources, and other services to support older adults and family caregivers. We're always happy to attend any events that are going on in the community that services older adults and caregivers. And then, as Diane mentioned earlier, we have our Central Plains Aging Network Group, which is a network for professionals providing services to older adults. We meet on the first Wednesday of every month at 9 o'clock at our office. And it's a time for agencies to provide information about what their services are, but then also it's networking. So you get to network with other aging service providers, share contact information, talk about events that you have going on. And we also have that networking group through email. We have an Aging Network newsletter that goes out every Friday of every week. So if you're interested in joining the Aging Network and getting those newsletters, you can contact our office and we can get you connected with that newsletter. And then we have an Aging Network group on Facebook as well. So agencies can go onto our Facebook page and share flyers about their agencies and events they have going on, or pamphlets that they have for their agencies to help get connected with other programs in the community. All right. Senior Health Insurance Counseling for Kansas, also known as SHICS counseling services. That is going to be your Medicare counseling. We have trained Medicare professionals that are experts in knowledge of all things Medicare. They provide non-biased, confidential counseling to Medicare beneficiaries, can assist with new to Medicare counseling, answer general Medicare questions, assist with the Part D drug plan open enrollment, provide information about the Extra Help program, and anything else that someone may have questions about regarding Medicare. This program is heavily ran by volunteers. So if you or someone you know is interested in volunteering, send them our way. We're always looking for volunteers, especially during the Medicare Part D open enrollment. That is a very, very heavy time of the year for our SHIC counselors. And so if you know someone that'd be interested in that, get them connected with us. All right, so with us being a part of the Aging Network, we have lots of partnerships that we connect folks with. We're also affiliated with the Butler County Department on Aging and the Harvey County Department on Aging. And we provide funding to a lot of external programs for them to also provide aging services, such as the Kansas Legal Services program, the Active Age newspaper, which many may have heard of. It's the largest newspaper in Kansas, and then also providing funding to senior centers across the 3 counties. All right, I talked about Sedgwick County Transportation a little bit. Again, this is a program that's offered for Sedgwick County residents that live outside of the city of Wichita. If they live outside of the city of Wichita and needing to be transported into the city of Wichita, we can provide that transportation at, I believe it's $3 for a one-way ride, and there's no age limit for this transportation service. It is available on a first-come, first-served basis, and our program is limited. We only have a handful of vehicles in our fleet, so it is encouraged that you schedule those rides in advance. And our hours are listed as Monday through Friday, 8 to 4:30, and encouraging as much as possible to try to schedule those rides 7 days in advance if you can. With us being the Sedgwick County Department for Aging and Disability Services, we also receive county mill levy funding to provide some programs as well. Some of those programs would include some in-home services, some physical disability services. As I mentioned, we provide funding to the senior centers in Sedgwick County, and then also utilizing some mill levy funds for that minor home repair that I mentioned, and then the critical assistance program, which the critical assistance program would be for individuals that have an emergent need and needing like some financial assistance to help avoid adult protective services case from being reported. So let's say that someone's living at home and maybe their hot water tank went out and they don't have the financial resources to purchase or repair that hot water tank, but they need that in order to maintain safely at home. We could potentially assist financially with replacing that or providing funding for repairs on that to help them maintain at home and have to avoid being displaced from their home. That's just one example. There's other different emergency situations that may come up where we could utilize the critical assistance program. The RSVP program is the Retired Senior Volunteer Program, wink, wink, which is available to adults 55 plus who are interested in providing volunteer services in the community. So if you or someone you know is interested in being a volunteer, you can contact our office. And we have partners all throughout Sedgwick County that we work with for volunteer opportunities. So when an opportunity comes up, they contact us, and then once we have a volunteer that we feel would be suitable for that placement, then we get them connected. This program is also available to folks that may be homebound but looking to provide some volunteer work. There's different arts and crafts that they could do at home. Making pillows or blankets for schools and things like that. So there's a wide array of volunteer opportunities that are available. In some circumstances, mileage and reimbursement may be available, as well as extra coverage insurance for the program. And then we also have volunteer recognition. So this would be a nice way to connect with other volunteers and then be recognized for all of your support. Oh, no, she's been gone for a while. Yep. Now it's Jennifer Youngers is over that program. And then earlier I mentioned the Intellectual and Developmental Disability Services, also known as your IDD services. That those services assist individuals who are on the HCBS IDD waiver through Medicaid. We are responsible for completing those functional assessments to determine eligibility for the waivers. And then also we provide targeted case management services, your options counseling if you're needing to access resource information, and then also the Project Search program, which is assisting with job placements for individuals living with intellectual and developmental disabilities. All right, so then we have several different ways that you can get connected with us. We have our website, the cpAAA.org website, as well as our podcast that's available on Spotify. It's called Aging is Living, which is a podcast where we bring in several different guests and talk all things aging services. As I mentioned earlier, we have several different Facebook pages. You can connect with us on our Central Plains Area Agency on Aging Facebook page, our Family Caregiver Support Facebook page, and then our Aging Network Facebook page, which you can access all of those just by going to that CPAAA page. And then you can subscribe to us on YouTube for those enhanced fitness classes and other wellness education videos there. Or just give us a call. Our toll-free phone number, 800-367-7298, or our local phone number, 316-660-5120. If you or someone you know is interested in any of those services or programs that I mentioned, you could contact us that way. I also, if I go to my last page here, have our email address up here, info-sc@cpAAA.org. That'll get you connected with our information and assistance team for you to ask questions about resources and programs. So as I mentioned, we cover Sedgwick County, Butler County, and Harvey County. So any services for those older adults or family caregivers in those three areas. If it's something that we don't provide internally, as I mentioned, we're a part of a network of hundreds of agencies in those three counties where we can get you connected with those resources. So that's all I have on my presentation there. But I also wanted to mention that with us being a resource center, we also publish, every 2 years, we have our Explore Your Options resource booklet. This resource guide is going to provide you with all things aging services, everything from A to Z that you could think of in Sedgwick County, Butler County, and Harvey County. It's going to be contact agency information, address, phone numbers, website information, everything from nutrition programs, housing services, mental health support, medical equipment, information about Medicaid, Medicare. It's all going to be in this booklet here. We do also have this booklet available on our website as a digital copy. So I definitely recommend that everybody have one of these on hand for resources. I also have with us a project that we've done recently called the All About Me book. This book is, it's awesome. It's something I'm very passionate about. This booklet gives older adults an opportunity to tell their story, to leave their legacy behind, tell everything about their childhood, their family tree, their favorite memories, their favorite color, just everything about them. But then also it's a safe place for them to keep all of their personal and sensitive information that they can pass on to someone if necessary at some time. So everything from your passwords to all of your online accounts, all of your bank account information, every bill that you have, your account numbers for all of your different, utility companies. If you have different assets that you want to list in here, or information about your end of life planning, if you want to provide organ donations, just everything that you could potentially think of, all in one place for you to share with someone that you trust with that information. I'm personally a caregiver. I was a caregiver to my mother up until her recent passing, but I'm also a caregiver for my father and my grandfather. And I wish that I had one of these available back when I was able to get that information from them. As I mentioned, my mother's already passed, but my father now has dementia, and my grandfather has aphasia, and so neither one of them can really talk or write or remember things. And so, as a caregiver, it's been quite the challenge for me to figure out how to pay their bills, or what their end of life plans are, or what my family tree looks like. And so, this is definitely something that I encourage that adults complete early on, while they, are still able to remember those things, while they're still able to pass that information along. It definitely makes life easier for you and your loved ones that may be assisting you later on down the road, or after you've passed on. So please consider this. They're free of charge. We make these available free to those that have a need or interested in that. And I did bring some with me today, so if you'd like to have one, feel free to take one as well. And then I just have lots of other goodies that are available. We have our pins that will, if you scan the QR code, it'll take you to our website. So this is just the easy way to always carry us along with you. So if you're wanting your resource guide here, just scan this QR code out of the pin that's in your purse, and it'll get you to your resources right there at your fingertips. Or if you're, needing to share some information with your neighbor or a family member, just an easy way to just carry us around with you so that you have that resource information with you. I like these pens in particular because they also have a little cell phone holder on them, so you could, sit your cell phone down and watch your videos on it at your table or whatever. So, and it has a stylus on the end. So these are pretty neat. And those that came today, feel free to take one as your little treat for listening to me this afternoon. So that's all I have for you. I did want to allow some time for any questions that anyone might have. I know I just threw a whole lot at you. Yes.
How many meals do you get?
So we provide, currently we have 5 meal providers in Sedgwick County, Butler County, and Harvey County providing. Oh, I'm sorry. Oh, meal. I thought you meant home delivered meals or meal. I don't have that information at the moment. I know it changes from year to year, and I don't have the most recent information. I'm sorry. Yeah.
Do you need transportation for people who live within the city?
Internally, we don't provide that service, but we typically will get people connected with the City of Wichita paratransit. Paratransit provides that door-to-door transportation for adults that have physical limitations and not able to access your typical bus routes. Mm-hmm. Any other questions?
I will put in a plug for that RSVP program.
Okay.
Because I know they're always looking for volunteers for that. Because the intent is you've retired with whatever your professional skills were.
Mm-hmm.
And you can now offer those skills to help somebody else. I mean, it can, whatever your area of expertise, it can, from writing to music to finances to whatever you have.
Yes.
You can help them, write something, edit and help write whatever it really is a wonderful way to use your talents and skills post-retirement
Absolutely.
whatever, even if you need to plan a family reunion, you know, you've got skills to help people plan an event. You know, then you can be on that list that you can assist somebody to plan an event. And that can be for anybody. But,
Yes.
you know, it's true that the retirees, it comes from the retired volunteers providing the service to anybody.
Yes, absolutely.
It's not just providing the service to other retirees, it's providing
Yes,
the service
to the community.
anybody. So
Yep.
therefore, you could be an event planner using those skills to plan an event. It really is a wonderful way to use some of your talents and skills that you hate to just see them die because you quit working, you can use them after.
Yes, I appreciate you mentioning that. Currently, we have dozens of, I don't want to quote the amount, but I would say at least over 70 different site locations that we're currently partnered with. But if we have a volunteer that comes in that has a specific skill set, then our staff could, you know, do some outreach and find some sites that might be interested in having some specialized volunteers. But everything from Botanica to the zoo to the airport, to the schools, to just, you know, little pop-up events that come up annually. Wide array of opportunities there for those volunteer services. Thank you for mentioning that.
So you brought some of these things along for us to pick up?
Yes, everything that I showed you today I have available. I also have our pamphlets available that just has a brief overview of some of those services that I mentioned, so that's something good. And then I have these fun cards that we recently launched a ageism awareness campaign, which we're educating the community about ageism awareness and trying to break the stigma of ageism and ageist remarks and thinking about aging in a negative way, but being more positive about the outlooks of aging. You might have earlier this past summer seen some of our billboards around or some of our advertisements on TV or on radio, but it's just kind of reframing the thought around aging and just, you know, changing how you conversate with folks about older adults and getting older. So this particular card example has the example of saying, you know, oftentimes people will just, you know, out of respect or, you know, not meaning any harm, will say, hey, you look great for your age. For your age. And it's like, you know, people don't think that, you know, for some that could be offensive to say, like, I only look great at the age that I am. Like, not just that I, you know, look great in general. And so just trying to think about how you can rephrase that to be more positive and not, you know, offensive by just saying, hey, you look great, you know, just something very minimal that could change someone's perception of what aging looks like. So I did bring some information on that as well. This is another topic that we provide educational presentations on is that ageism awareness. So, but yeah, everything that I mentioned I did bring for those that like that.
And you also can just get the active aging newsletter. I don't know if any of you get that. And that's fun to read that. That's free of charge too.
Yep.
That kind of.
All right. Any other questions I can answer?
Thank you very much.
Thank you.
Yes.